Hello, my name is Charlotte. I want to tell you how I found out I have kidney cancer. So my heart would beat really, really fast, like up the side of my chest, as I was walking up the stairs, or if I walked up inclined hills, I would also starve for breath a lot. So I immediately went to the heart doctor and did 3 tests: the stress test, the echogram, and I had a monitor on my heart. And he said it was fine. So he thought maybe it might be thyroid. And I was taking a little thyroid medicine, like 5 milligram. And so I saw the thyroid doctor. It was a thyroid specialist. And he said that I don't see how that little bit of medicine you take can cause these side effects. But I did quit taking the medicine 3 days before I saw him, and I started feeling better. And he sent me to have an echogram of my thyroid, and he said I didn't have thyroid disease anymore. By day 5, after I stopped taking the levothyroxine, I was feeling a lot better, like 75% better. So I was thinking, okay, it was this medicine. I'd taken it for almost 2 years, but it was working against me because I didn't need it anymore. And so I got a little side job, worked for 3 months, and then boom, after about 3.5 months of stopping the levothyroxine, the same symptoms hit me again. It was like my heart would feel like it was going to beat on my chest when I walked up steps or inclined hill. And then it's like I was always starving for breath. So I went ahead and made an appointment to a hematologist because I had a high Dean dimer, and I was anemic, and some of my other blood work was kind of off. So I'm like, what's going on here? So I thought I'll just go to a hematologist. So I went to the hematologist, and he told me that it was not cancer. It was on Wednesday. He said it is not cancer. I don't think he really knew what it was. He said, you're anemic, and we had to figure out why you have anemia. Well, I noticed that I was passing urine in my blood. So I immediately went to the doctor, and my family doctor, and she did a test, said that didn't look like it was an infection, but she was going to send it off. And I did tell her that I had a complex kidney cyst that was found out in 2023. So they did an MRI and a CAT scan, and they said just do a follow-up the next year with a CAT scan. So the next year I did a follow-up with a CAT scan, and the nurse practitioner told me, this was in 24, to go to a urologist. Well, I went to a urologist. He was an older urologist. I thought, well, he knows there's a problem. And he looked at the comparison. He said I would never have it checked again. But when I went to my family doctor and I told her what was said and so on in 25, this was in 2025. She said, well, I don't agree with that. So she sent my urine off for a culture. Come to find out, it was not a kidney infection. And she also had a follow-up of CAT scan, no, MRI on my kidney. And that's when she called me back in, and she wanted me to come in the same day that they called me for an appointment, which never happens. Usually it's like 2 weeks before you get back into the doctor. and she told me that it was cancer and that it had spread into the vein. So now I'm looking to see what's next. My next appointment is at Markey Cancer Center in Lexington, Kentucky.